Hello, everyone. My name is Hamid Madavi and the Heart Brothers Foundation. Welcome to another one of our webinars this evening on patient education. Today, I have the privilege of having with us Matt Goodwin. He's the Vice President of Medical Affairs at scPharmaceuticals, and he is going to be talking about navigating heart failure, recognizing and managing fluid buildup. scPharma has some new technology that will be significantly beneficial to patients who have heart failure and are managing their fluid overload. Before I turn it over to Matt, I would just want to run through a couple of slides, talk about some webinar P's and Q's, and then we'll get going. So Zoom best practices, please maximize your screen size. Comments and feedback, please put them in chat. And if you have the questions, we will have a Q&A session at the end. Please put them in the Q&A session. So just for those of you who don't know us, who we are, Heart Brothers, we're patients. We're just like you. We've all had heart failure. Most of us have had heart transplants. And we've made a commitment to give back to the community and pay it forward. Our mission is to help and support heart failure patients and their loved ones navigate a life with heart failure and all its challenges. Just want to briefly, the information you hear here and it's presented is intended to inform you of what's new treatment methods, medications, medical devices. We're trying to keep the patient community informed and updated of what's out there and new products that come out. But please, please, please consult your physician, consult your treatment center before to determine what is the best treatment for you. Do not change your treatment methodology or regimen based on what you hear here. Please consult with your doctor. And with that, if you want to get in touch with us, you can get in touch with us through the Heart Brothers Foundation, through Facebook, and on Instagram at Heart Brothers or /Heart Brothers/Foundation. Thank you very much. I'll be seeing you back at the Q&A session. And with that, I'm going to turn it over to Matt. Matt, there you go. Thank you.
Thank you, Hamid. Appreciate the generous introduction. Can you hear me? Can everyone hear me? I just want to make sure.
Yeah, I can hear you.
Yes. Okay, let me share my screen here. Here we go. And are you able to see the slides there? Hamid, I'll put it in presentation mode. Be able to see the slides?
Not yet. I'm still seeing my slides. Let me see if I need to stop sharing or.
Let me try again here. Okay, here, this should work. How about now? No?
Hold on.
I'm seeing them, yes.
Okay, great. Great. Well, let me put it in presentation mode and then I will, can you see it in presentation mode now? Or is it still?
Not in presentation mode yet.
Sorry about the little logistical issues. Here we go. This should work.
Perfect.
How about it? And then, okay. So again, Hamid, thank you for the opportunity to speak with the group. Really honored to be here and talk to you today about navigating heart failure. The title of my presentation is Recognizing and Managing Fluid Buildup. Just a little bit quickly on myself, as Hamid mentioned, I'm the Vice President of Medical Affairs here at scPharmaceuticals. I am a pharmacist by training. Graduated from a pharmacy school in Iowa back in 2006. And I've been working in the pharmaceutical industry and as well as in clinical practice since my degree. So with that said, I'll jump in here. So we're going to talk today about heart failure and congestion. And first, we'll spend a little bit of time reviewing what heart failure is, its overview, and the impact that it has on patients and caregivers. And then dive into fluid buildup, congestion, and heart failure. And then we'll touch on the role of diuretic therapy in the management of fluid buildup. That's a term we use. Fluid buildup, congestion are synonymous and essentially means the same thing. And then lastly, we'll talk about Furoscix, which is a furosemide injection that's given subcutaneously through an on-body infuser that scPharmaceuticals developed and launched in March of 2023. So first off, heart failure, as many of you I'm sure know, is a huge burden to society and continues to be a huge burden despite novel advances in therapies and devices over the course of the many years of the past. Between 2017 and 2020, 6.7 million adults in the US have heart failure, active heart failure. And shockingly, and maybe not shockingly, that number is going to go up to an estimated 8 million people in the US by 2030. And that comes from the most recent heart and stroke statistics publication that looks at this and estimates the amount of people with heart failure living and those that they expect to develop heart failure down the road. And in 2020, not only is, or I guess I should say, not only are there a lot of folks with heart failure out there, but it's also a difficult disease that presents with a lot of challenges, and it can lead to mortality. I mean, it was the cause of over 80,000 deaths in 2020, and it's responsible for 1 in 8 deaths. And fluid buildup at hospital discharge is associated with increased death at 30 days post-discharge. So trying to avoid issues when you have heart failure and avoid hospitalizations that may be unnecessary is important because there's a link between hospitalization and death. So real quick, we're not going to spend a ton of time because you all know, I'm sure know about heart failure, but I wanted to mention the two main types of heart failure. This is a graphic here of the heart, and it shows in the middle what a normal heart does, how blood's pumped in and out the different ventricles of the heart. But when you have heart failure, you can have either systolic dysfunction, where on the left of the slide here, where essentially the heart is not pumping as well. So the blood is not being pumped throughout the body, and it's not able to supply your organs and your body with the necessary oxygen and nutrients that it needs. And this is due to a weakened heart muscle. And that's called systolic dysfunction, or some of you may have heard of it called heart failure with reduced ejection fraction. On the right, the other type of heart failure is diastolic dysfunction. This is also called heart failure with preserved ejection fraction. And this is where less blood is able to come in and fill the ventricles. And this is due to a stiffening of the heart. So, and it leads to all the complications such as fluid buildup and others that we'll talk about. So there's two types: either your heart's not pumping well enough to vascularize and supply your organs with enough blood, or it's stiff and less blood enters the ventricles, and it's still unable to be effective in supplying oxygen and nutrients to the rest of your body. So what are some of the signs and symptoms of heart failure? Shortness of breath. This is the biggest one, and it's a scary one. I've heard patients and providers alike talk about this with heart failure, where it feels like you might be underwater or drowning or unable to breathe. It's a scary aspect. Sometimes patients may need to cut back on normal activities. So things like walking to get the mail maybe be more difficult due to shortness of breath. And there may be need to, because of fluid buildup or congestion, to sleep with pillows to elevate the head of elevate your head so that that congestion can drain and is not as cumbersome on the body. Things like feeling tired or fatigued quickly, again, inability to walk as far as you used to, or do the general activities that you might have prior to your heart failure. There can be weakness, particularly in the legs when exercising. Lightheadedness and dizziness is a common sign and symptom of heart failure, as well as a rapid heart rate even while resting. And from the slide before, maybe that makes sense because that's really your heart trying to pump harder and faster to get that blood around your body and help you reduce the symptoms and negative aspects of it. And then last but not least, swelling in the lower feet and extremities, things like your legs, feet. We call that edema, or in the abdomen, which is a medical term for that's ascites. And that plays an important role because that can, especially the swelling in the abdomen or what's called gut edema or ascites, can really make it challenging for oral diuretics to work effectively. And we'll talk about that a little bit later. So fluid buildup in heart failure, it's really due to the body or the heart not being able to effectively pump blood throughout the body, as I mentioned before. Also, as mentioned, the most common signs and symptoms in patients with heart failure are things like swelling, difficulty breathing, which we call that in medical nomenclature, dyspnea, inability or limitations in physical activity. Weight gain is also common because you're retaining more fluid in your body. And a dry cough are some of the common signs and symptoms. The most common reason patients with heart failure seek medical care and are hospitalized is due to fluid buildup or congestion. And as you might imagine, this is associated with a tremendous reduced quality of life. It's typically managed with oral diuretics. We'll talk about some of the types of oral diuretics and where they work in the body. As I mentioned before, persistent congestion or continued congestion at hospital discharge. So if you go to the hospital and they try to give you IV diuretics to get the fluid off of you, and you don't happen to get all that off at the time of discharge, that's associated with having worse prognosis and maybe things like rehospitalization or other issues that can come into play. So I wanted to show a little checklist here. There's a lot of resources out there on various websites like the Heart Failure Society of America, or this is from the American Heart Association, where they have self-check plans. And this self-check plan, I won't go through it in full detail, but it has kind of three main components. Up at the top, you see excellent, you're doing well. In the middle is kind of pay attention or use caution, and at the bottom is a medical alert. And I think tools like this are helpful to track because it asks you to track like many of your physicians or providers probably already do, track your daily weight, make sure you take your medications as directed, continue to eat a low sodium diet, and make your follow-up visits that are scheduled with regularity. And tracking this on a consistent basis is good. Where doctors or patients like yourselves or caregivers can use this is when, by tracking, you can see where something's abnormal or out of the normal expected situation. And so in the middle, you can see things like sudden weight gain of 2 to 3 pounds, or in a 24-hour period, or 5 pounds in a week. that's generally a trigger should tell you that, hey, something's going on in my body, potentially related to heart failure, and I should probably call my doctor or healthcare team because I may need an adjustment in my diuretic regimen or other medications related to heart failure. And then at the bottom, in addition, if you start having shortness of breath at rest, coupled by sudden weight gain of that 2 to 3 pounds in a 24-hour period or 5 pounds in a week, most providers will tell you that that's something where you really need to call us right away, call 911, because you need to be evaluated right away. So sorry about that. My office light went off, but there's a lot of resources out there. I thought this one was simple, and it's available at the citation here, if you'd like to have to print out and download. So what's the role of diuretics in heart failure? These are intended to improve symptoms and your ability to exercise or walk normally without that shortness of breath in patients that have signs and symptoms of fluid overload. It's also they're also necessary to help reduce the risk of heart failure hospitalization in patients with symptoms of congestion. And then they're also recommended for use in any patient that's admitted to the hospital with signs and symptoms of fluid overload. Diuretics are one of the first agents that are going to be given to you, most likely in intravenous or IV form if you're admitted to the hospital. And they're adjusted at a dose and duration that are consistent with your signs and symptoms. So it may vary based on person to person in terms of how much of a dose of diuretics you get. In terms of how the diuretics work, I wanted to spend a few minutes describing where and how they work. So diuretics overall, to keep it, kind of from a simplistic perspective, they work in your kidney, right? And they help to block salt reabsorption in that kidney. And a kind of easy nomenclature, where salt goes, water follows, right? So if you think about that, they're blocking salt reabsorption in the kidney, so it's preventing water from being retained in your body. This picture here shows what's called a nephron, and that's essentially like a powerhouse. If you think about it, a powerhouse cell or feature of the kidney that helps to essentially filter blood and urine and regulate blood pressure. It does a lot of things for your body, and regulate fluid levels. And there's different areas of the nephron where diuretics work. There's mainly three types of diuretics that we'll talk about today. But the first one and the most common diuretics that folks with heart failure use are what's called loop diuretics, and they work within this nephron area called the loop, and they help to block sodium reabsorption or salt reabsorption in that area. There's also other diuretics types called thiazide diuretics. These are things like metolazone or hydrochlorothiazide. You may have heard that name, or some of you may be on those medications. These block sodium reabsorption further down in that area of the kidney. And sometimes physicians will use these two drugs together, right? They'll have you on a loop diuretic to try to block salt reabsorption at this point in the kidney, as well as a thiazide diuretic to help enhance the prevention of salt reabsorption and ultimately water coming into your body, because that's what, that's why when you have issues with heart failure, you gain weight, because many times it's the fluid that's retained in your body causing things like the leg swelling, the difficulty breathing because fluid being in your lungs, etc. And then last but not least, there are other drugs as well, other diuretic types, which we'll talk about, called potassium sparing diuretics that work also in the kidney, but in a different area. I don't think they're shown here specific. Yeah, sorry, they are shown right here. They're also called mineralocorticoid receptor antagonists, but they work a little further down in the kidney. So what are the loop diuretic names? I'm sure some of you have heard of these: furosemide or Lasix. This was Lasix is the brand name, or used to be the brand name, but furosemide was developed back in the 1960s, so it's been around for a long, long time. I was always taught in pharmacy school they call it Lasix because it lasts 6 hours. I don't know if that's true or not, but it was an easy way to remember what the brand name of the drug was. This is the most commonly prescribed loop diuretic. It's typically dosed 20 to 40 milligrams once or twice daily. You can see there the maximum daily dose. I won't read that in duration, but the other types of loop diuretics then subsequently were developed called torsemide and bumetanide. These were developed to try to increase the amount of the drug that gets into your bloodstream because that's necessary for it to be able to have its effect, get into the kidneys, and then be able to block that salt reabsorption and water retention. These drugs are also dosed once or twice daily, and you can see the dosing there as listed. The other types of diuretics that I mentioned in the picture are what's called thiazide diuretics and potassium sparing diuretics. I've listed some of the common types or common names of thiazide diuretics and potassium sparing diuretics. Again, the ones most commonly that I've seen prescribed are hydrochlorothiazide. Metolazone is a very common one. And the potassium sparing diuretics that are most commonly prescribed are amiloride, spironolactone, and triamterene. And you can see the different types of dosing based on the prescribing information and their maximum total daily dose as indicated in the graph. So what's the challenge with oral diuretics? I mentioned before that furosemide was developed first, and then subsequently torsemide and bumetanide were developed. But as I mentioned at the start, fluid buildup or congestion, many times it can find its way or migrate to your abdomen, your stomach, your gut. And when you have that, it makes it very challenging to absorb diuretics. And the gut is the area where diuretics need to be absorbed to get into the bloodstream and then get down to your kidney to work. And so when you have heart failure and fluid buildup, many times these oral diuretics don't work as well. And you can see on the right or in the middle, there's a pictorial showing, that gut edema prevents the absorption of those drugs, not allowing them to get into the bloodstream. And because of that, only 10 to 90%, so a wide range, right, of that drug is able to get in. And if it can't get into the bloodstream, it can't really produce its effect. We call that term, the medical term is called bioavailability. So how much of the drug gets into your blood. So with that said, oral diuretics and outpatient treatment options for patients with heart failure and congestion are quite limited. We know that about 50% of patients admitted for heart failure are discharged without being completely dry or completely decongested or having all the fluid taken off them. And generally, or most commonly, outpatient treatment options for heart failure, if you're having if your oral diuretics aren't working, there's really only a couple options until recently, and those are listed here. That's either referring you to an outpatient heart failure clinic to have IV diuretic therapy. And the reason why IV diuretic therapy is going to work better than orals is because if you think about it, IV goes right into your bloodstream, and it can get right to the kidney to produce its effect. It doesn't need to get absorbed through the gut or the abdomen. And so that's a therapy option that many times physicians will use when oral diuretics aren't working well enough. The challenge with that is that there's only about 20% to 25% of hospitals out there that are able to do this. So it also presents a logistical challenge depending on how far you live from there, and a coordination of being able to get get to that outpatient heart failure care unit, et cetera. And then another option that sometimes happens that I mentioned before is prescription of a enhanced oral diuretic regimen. So it might be increasing your dose, your oral diuretic dose of furosemide, or adding a thiazide diuretic on top of your loop, or sorry, your oral loop diuretic. So that's also an option that's there. But recently, and I mentioned in 2023, in March of 2023, scPharmaceuticals developed what's called Furoscix, or furosemide injection, which is a 80 milligram and 10 ml for on-body infuser injection of furosemide that's delivered subcutaneously through the body. So what is Furoscix? On the right here, you can see a picture of what the device looks like. And on some of the subsequent slides, I'll show you what some additional photos. But Furoscix is a prescription medication that treats congestion or fluid buildup caused by fluid buildup in a person with heart failure. Importantly, it's not to be used chronically, so day after day after day. It's not like your oral diuretics, but it's used to help when you have congestion that isn't managed by oral diuretics, and it should be replaced with oral diuretics as soon as possible. And you need to follow the instructions provided by your physician or care provider when taking Furoscix. On the next two slides, this is when you have a drug approved by the FDA, we develop what's called important safety information. I'm not going to read through this in verbatim detail, but I did want to highlight a few important points as I scroll through this in the next slide. So before taking Furoscix, you need to tell your healthcare provider if you have liver problems, trouble urinating, or are allergic to any of the ingredients in Furoscix. And if you're taking other medications, it's important to let them know that. Some of the possible side effects that are listed here are dehydration, and that can cause things like dry mouth, thirst, muscle cramps, dark urine, headache, dry skin, or nausea. Low blood pressure is also a potential side effect, which may make you feel dizzy or lightheaded. Some of the other potential side effects are things like high blood sugar, especially if you have diabetes, and ringing in your ears or trouble hearing, and your skin may be more sensitive to sunlight, and that's just how, based on how the molecule works in the body. Common side effects with Furoscix, because it's an infuser that sits on your body with an adhesive, are things like bruising, redness, swelling, and pain at the infusion site. And importantly, as a reminder, if you do not receive a full dose of Furoscix when you're prescribed it by your healthcare provider, you need to call them for more instructions. So I'll move along here to show you a little bit more and talk about in detail Furoscix. So this is on the right, a really good photo of what Furoscix looks like. Again, it has the device, which is the on-body infuser. On the back of it, it has a medical grade adhesive that's used to adhere to either side of your belly button on your abdomen. And the drug product comes in a drug cartridge, which is shown here, and that's inserted into the top of the device. We call it the cartridge holder, and it's closed. And then you peel off the adhesive and stick it to your abdomen and press this blue button. When you do that, this Furoscix delivers 80 milligrams, but it does it in kind of a two-phased fashion. We call that a biphasic profile. So it delivers 30 milligrams in the first hour and then 12.5 milligrams per hour for the next 4 hours. So it's a 5-hour total delivery time to help you diurese or rid yourself of the extra fluid buildup. Importantly, it does have visual and audible feedback, so it blinks green as it's infusing. You might even hear it kind of the piston within it, or as it's being infused, you might hear it move. And it also has audible feedback if there was an issue where the device got knocked off your stomach, or it came off, or it malfunctioned, it's going to let you know through a beeping or alarm system. And we feel that it's a very patient-centric design. It's the size of maybe I have one right here so I can show you guys. This is the size of what it looks like. It's about the size of smaller than an iPhone. And again, there's the back side of it with the needle that comes out. So it is delivered subcutaneously. It's a very small needle, 27 gauge needle, which is about the size of like an insulin needle, if you've seen that. And it's worn again for 5 hours. So a little bit more about what comes in the packaging. On the right here, this shows what a FUROSCIX kit looks like. It includes things like the pre-filled cartridge that includes the actual drug product. So it makes it relatively easy for you to just load that into the cartridge holder. It comes with the on-body infuser, alcohol wipes because those are necessary, or the instructions for use say to swipe the area of adherence on your abdomen prior to use. It also comes with prescribing information that details some of the important safety information and details about the drug, and then as well as a detailed instructions for use, which walks through the steps to administer FUROSCIX correctly. Importantly, FUROSCIX should be stored at room temperature in the original carton until use. The good news is it does have up to a 2-year shelf life, so it's good for 2 years up until the expiration date. And it's intended for use in a setting where the patient can limit their activity for the duration of administration. Is another important point. So this is a picture from our instructions for use, which again essentially tell you how to use the medication effectively. There's really 4 main steps with FUROSCIX to administer or go through the full administration. It's preparing the infusion, and this is inserting the cartridge in the correct manner. And preparing or inserting the cartridge in the correct manner, and then closing the cartridge holder. The next aspect is really applying the infuser. You can, as seen here, apply it on either side of the abdomen, 2 inches away from the belly button, and making sure that adhesive is pressed firmly on the skin so it stays on. And then it's really as simple as pressing the start button, the blue button. Again, as I mentioned, it will beep when it's infusing over that 5-hour period. And then it's removing the infuser and putting it into a sharps container to dispose of it effectively. That it is important to note that FUROSCIX is a single-use drug device product only. It's not to be reused. You're not supposed to use any other cartridges or medicines inside the on-body infuser. And importantly, you're not supposed to get the on-body infuser wet. So things like showering, bathing, swimming, or really doing heavy exercise where you start sweating when wearing the on-body infuser is not recommended. So I'm going to show this is my second to last slide. I want to show a video here of this is a patient video that we have created related to how to administer FUROSCIX. I think it's helpful to see this. So it's about a 4 or 5 minute video. I'll move it along and let you all watch it. Can anybody hear the presentation or the video?
I cannot, Matt.
I'm trying to think how. I don't know why that's doing that. Let me try to pull it over. Could you see it on the screen, Hamid?
Yes, I can.
1 second here. See about switching here. Stop sharing. Why can't I? How about now? Can you hear that? I mean, if it's like that.
No,
Let me 1 second here. Sorry about that. I apologize here. Just give me a minute. I'm going to try to figure this out, why it's not allowing me to, or allowing you all to hear. Da, da, da. How about now?
no, unfortunately not.
Okay. I'm gonna just I can play the video. Can you all see can you see the screen, Hamid?
Yes,
Okay. I'll just play the video. I'm not sure why the audio is not working through the Zoom platform. And as a follow-up, Hamid, we can send the a link to this so that folks can listen to it.
yep,
Um, okay.
absolutely.
This is the part that I mentioned earlier where the cartridge, the medication cartridge goes into the cartridge holder and then you close the cartridge holder. So as this plays along, I'll speak to a few important points that come along during the administration. This is the piece where, once that, as the last part of the video showed, you remove the white piece on the on-body infuser to reveal the sticky adhesive that goes on your stomach, and then you can press the blue button firmly to start the medication delivery. This is an important part as well. Just that I mentioned before, limiting activity and bending movements. If you do too much active movements or excessive movements, the reason behind this is just again wanting to ensure the device stays adhered to your abdomen, and isn't knocked off if you're hit a counter or a table or something like that. So that's the piece where I mentioned how it has a visible and audible feedback. So if there is an issue with the device, it will blink red and you'll hear the alarm. It will audibly you'll hear it, and at that case, remove the infuser and call your healthcare provider as mentioned. And with that, I'm going to stop here because we already reviewed the important safety information previously. Again, apologies for the sound, but hopefully, I think the video it's pretty easy to follow along with how it's administered, and without the sound. Um, all
Matt, if you
right,
give me the link to the video, we can post it on our website with the link of
perfect,
the video.
perfect, perfect. Okay, I'm just the last slide here is just a summary. Burden, just to reiterate, the burden of heart failure is quite substantial and it's continuing to increase, year over year. Fluid buildup and congestion is the most common reason patients with heart failure seek medical care and are hospitalized. And diuretics are the main agents used to treat congestion or fluid buildup, but limitations do exist. As I mentioned, oral diuretics have absorption issues that sometimes don't allow them to produce their required effect. So with that, thank you for your time. I'll pause for questions, comments, thoughts.
So Matt, I'll start with the first question.
Okay.
So I know I'm going back to my heart failure days, and I know a lot people with heart failure also potentially can have challenged kidneys and sometimes challenged livers. You made a mention of if you have liver issues. So what is the definition of liver issue? Basically, if you have your liver enzymes and numbers are off, is that what?
Yeah, so if you're diagnosed with liver impairment, generally that's measured by enzymes called like ALT or AST, or if you have cirrhosis, diagnosed cirrhosis, that's a contraindication to use for FUROSCIX.
Okay. So here's a question: does insurance cover this drug?
Yes, it is covered by insurance. We have a team of folks that work hard and with variety of payers and insurance agencies to gain coverage and access. I'd say for specific insurances, that'd be something that we could follow up with you on, or your provider could discuss with one of our sales reps, because it does vary throughout the country, but there is definitely coverage both on commercial plans, on Medicare Part D, Medicare Advantage, et cetera, Medicaid as well.
Thank you. Uh, is this is this pretty fairly available across the states?
Yes, it's available everywhere in the United States. We distribute it through a specialty pharmacy. We call it FUROSCIX Direct. So it's We make it as simple as possible. When your provider writes a prescription for Furoscix, it goes to Furoscix Direct. They reach out and contact you to get to make sure you're okay to receive it, and they ship it to your doorstep, or however many devices or devices your prescriber has decided to prescribe.
Perfect, thank you. I have another question. I thought this at our last symposium where you passed these around, loved it. Is there a model coming out that is good for more than one use?
No, so our model is developed for single use only. And we do not have a plans to develop a on-body infuser that's continually worn, if that's the ask or the question.
Do you have a program to help people whose insurance doesn't cover it?
Yeah, so we have a patient assistance program, and our first Furoscix Direct entity or organization or group that we partner with, they actually work with to find other support programs or support patient assistance programs that may have monies available to help with the cost of the medication. So we definitely do have those.
Here's another question. At my peak heart failure, I had paracentesis every couple of weeks, or they would take 3 to 5 liters of fluid off. Would your product help eliminate this process?
That's a tough one because generally paracentesis, in my understanding and expertise, is used when you may have some degree of liver failure or complications with your liver. It's so Furoscix is not going to replace paracentesis. I would say it's not that it couldn't be used in that setting if you had heart failure and were for some reason having paracentesis to remove your gut edema, but I don't think it'd replace it completely, and we haven't studied it in that situation.
This medication is not available at your local drugstore.
It's not. It's distributed through a specialty pharmacy, as I mentioned, that we call Furoscix Direct. But it is available to be shipped to your door after a prescription's approved, generally within 24 to 36 hours after the prescription.
The gentleman who asked the question about the paracentesis said he did not have liver problems.
Okay. Yeah, I would say from that perspective, I mean, he should speak with his doctor. I don't think it would replace, it's not indicated to replace paracentesis, but if he had if you have heart failure with fluid overload, congestion, fluid buildup, it can certainly be used in that setting.
Any more questions? Anyone? With that, Matt, thank you so much. Really appreciate this. Appreciate your time. Appreciate the knowledge, the education you shared with us. And it's been excellent. And
Thank you, Hamid, and thank you everyone for listening. I appreciate all your comments and questions.